Hey guys, my name is Bailey, and I just wanted to make a video to pretty much teach all those caregivers at home who never had any formal training how to do some activities of daily living. And today I am going to talk about bedbound care. So, care for any patient who can't get out of bed, because there's a lot of things that are different. And it can be hard when you don't have any formal training of how to do those things. Just a little bit of background about myself. I am an ICU nurse and I'm finishing up my bachelor's in nursing at Weber State University. So I'm gonna show you guys a video of how at my job we do bedbound care. So there's other things that go into it depending on the patient, obviously. But what you're gonna see in this video is myself and the awesome CNA instructor at Syracuse High School doing a brief change and a bed bath and changing all the sheets and linens on the bed. So that's what you're gonna see. It's all in one video because I personally think that what's best for the patient and for you as the caregiver is going to be to do as many cares as you can at once, especially when it involves turning a patient who is probably uncomfortable moving positions. So we want to do as much as we can at once. So here's that video for you guys.
Deborah, I'm Janine and this is Bailey, and we're here to help do a brief change for you. Alright, I'm going to have Bailey lower the head of your bed so you're flat. Or we could change your shirt too. It now looks a little messy.
If you start feeling like it's hard to breathe, let us know and we'll raise it back up for a bit. Right.
There's a little mess here.
Yep. Yeah, this might be a little bit cold. Okay. And let's roll that way. Okay.
Alright, Deborah, we're going to roll you on your side, okay? Ready? 1, 2, 3.
I'll have my garbage over here that I'm gonna put this in. And then I'm gonna clean up her back side. Garbage. And then at the same time, while she is rolled like this, I'm gonna go ahead and do the back side of her bed bath. So, yeah.
Oh, sorry,
That's
Deborah.
okay.
Are you okay? It's had lots of water in it too.
So I have my nice warm soapy water, and I'm just gonna wash her back. And her thighs. And then we'll go ahead and roll it back. Yeah.
Got one washcloth in there?
Yeah.
Alright, Deborah, I'm just gonna wipe off your face, okay? I'll start with your eyes.
So you always want to go from clean to dirty as best you can, so starting with the eyes is a great place to start.
Alright, Deborah, I'm just gonna wash your arm. I'm gonna wash your hand and go all the way to your armpits. Alright, I'm gonna reach under and just wash your chest, okay? She has a bit of pressure ulcer underneath her brush there. We'll just pat that. It's probably pretty sore. We'll put some ointment on that for you.
Well, if you wanted to. Yeah.
Toes.
Oh yeah.
Put some lotion on your feet, your legs.
But we're not gonna massage your legs. Just put some lotion on.
Get you a clean gown. She doesn't have an affected site, right? She's just not feeling awesome.
If she did have an affected side, though, we would put the affected side through the sleeve first, and then the other side. Okay, now we're going to change the bed sheets now that she's all clean.
What side do you want her to go on? My side?
Yeah.
Alright, Deborah, we're gonna roll you on your side, okay? Just cross your leg here. Ready? 1, 2, 3. We're just gonna hang out here for a second while Bailey takes her dirty sheets off.
So I'm rolling up all of the bedding as far as I can under her. Then I'm gonna grab my prepared stuff right here. So what I have here is a fitted sheet, a draw sheet, and a chucks, and it's all rolled up together, so it just makes the whole process a little bit faster, which is better for the patient and for you. So I'm gonna tuck that under as far as I can, and then we can go ahead and roll Deborah back.
Okay, there we go. roll you on this side, Deborah, okay? Just for a second while we get this clean sheets out. Roll it dirty side in and put it all in the hamper, never on the floor. Make sure there's no wrinkles as best we can. Alright, I think we're good. Okay, roll back, nice and quick.
And then we have a clean pillowcase for you.
We're not folding nicely like the hospital folds.
Yeah.
When they're so easy. Alright, we gotta
Just
turn
the
it. Yeah, that way this way.
these are big.
Yeah, and then really long. Where do we have over there? You look nice and cozy.
Alright, so we've changed her bed sheets and everything. One thing you definitely want to do if they're going to be bedbound is focus a lot on preventing any pressure injuries. So one last thing we're going to do before we leave her is turn her to one side, and that's going to help prevent pressure injuries. And you really want to do this like as often as you can. Every 2 hours is ideal, but sometimes that's not really an option to do every 2 hours, but just as often as you can. So this sheet that we have here, I don't know if you noticed when we put it on, but we have a folded sheet under her, and that's going to make it really easy to turn her, especially if it's just you. You can grab the sheet and turn a lot easier than if you're just trying to grab shoulders or hips or something like that. So we're gonna
Bring her this way.
Yeah.
Alright, I'll just reach over. Ready? 1, 2, 3.
I'm just gonna put a few pillows under this left side of her. There we go. It's just gonna prop her up to one side and get the pressure off of one side. And then, yeah. Pillow between the knees. Lots of pillows.
Lots of pillows. There we go.
There we go. Pillows are a great way to make sure that you don't have any excess pressure on the bony parts of the body, like the heels, the knees, the elbows. If you have a bigger person, they're probably gonna just crush the pillows, and it's not gonna do a whole lot of good. So if you're able to, I would recommend getting a wedge that's made for this kind of thing, for turning people, because it's gonna hold up a lot better and be better for your loved one. So that's all I have, I think.
You look great, Deborah. Here's your call light and your water if you need anything, okay? Just push it and let us know. You did like
things is you'll notice that I had to lay her head back to turn her, because that's a more natural position to turn when you're flat rather than sitting up. One issue with that is if your loved one has a hard time breathing when they're laying flat. So if you have a hospital bed and that's an option to raise and lower the head, then definitely let them know. If they can communicate with you, let them know if you feel short of breath or if you're having a hard time breathing. Let me know and I'll sit you up a little bit, and then we'll continue and put the head back down. So that's another reason why it's beneficial to go fast when you can. Another thing that I want to talk about is cleaning from the clean areas to the dirty areas. So I talked about that a little bit in the demonstration video, but you definitely want to, like we said, start with the eyes, because anything else is going to be dirty and you don't want that getting into the eyes. And same with the brief change, especially females. You want to clean front to back. It's just going to help prevent any infections. That's why we do that. When we changed the sheets, it was kind of hard to see, but I had laid out a fitted sheet and then a draw sheet, which is basically just a folded up sheet, and a chucks pad, which that is pretty much a pad that is used to soak up any liquids, so urine, stool, things like that. You can put a chucks pad down underneath the patient, and that way you're not going to have to totally clean all of your bed sheets if there's a mess that the brief doesn't contain. And they do have disposable ones like you saw in the video, and they have non-disposable ones. So that might be a little bit of a cheaper option to use non-disposable ones. You're just going to have to take those out and wash them when they get dirty. So I laid all those out previously on a table and then rolled them up halfway so that when we had her turned, I could just shove the rolled end under her back and everything was already set up. So it makes the whole process a lot faster. And so under the chucks, there was a draw sheet. And like I said, a draw sheet is pretty much just a folded up sheet. We use them a lot in hospitals because it makes it way better for us and the patient when it comes to turning them. So you can just, like you saw, you can grab the draw sheet to turn them and it's going to be easier for you. And then you can also, if you have two people, you can have one person on each side. They can grip the draw sheet and use that to boost the patient up in bed. It's a lot easier than trying to boost someone up by their armpits or something. That's uncomfortable for the patient, it's awkward for you, so draw sheets are definitely an easy way to go, and it's something that you probably already have at home. Another thing is, anytime you're turning or repositioning a patient, make sure that your back is straight. It can be hard, especially if your loved one is a bigger person and you're not. It can be hard to turn and reposition them. And so keeping your back straight is going to go a long way to making sure that you are safe as well. You don't want to hurt your back, because if you're out, then who's going to care for them? So you need to take care of yourself so that you can take care of your family member. And part of that is knowing your limits. So like I said, if you might be the only one at home taking care of your family member. And so a lot of this stuff is going to be hard. We had 2 people in that video, and it went really fast and it's easier. But if it's just yourself, it's hard. I know at my job we have to do this kind of thing a lot because a lot of our patients are bedbound. And if my patient is like a 90-pound little old lady, then yeah, I can probably do this by myself. Or if the patient can help me turn them a little bit, then I can probably do it by myself. But if they're bigger and I'm having a hard time just rolling them to one side, let alone holding them up and cleaning them up, I'm gonna need some help, and I know that. So if you can, try to plan these cares so that you can do them when someone is with you. That way you protect yourself and you're not gonna get hurt. Let's see. Some other really good things that you can use to prevent pressure injuries, because that is a major concern with bedbound patients, is pressure injuries. You can use heel protectors. So it's basically a little foam piece that goes under their heels, and it keeps their heels off of the bed and prevents pressure injuries from developing on the bottom of their heels. You can also use a bed cradle, which is basically a little piece of metal that connects to either side of the bed, and it's just kind of like a wire that goes up over the bed, and it keeps the sheets off of their toes. So people can actually develop injuries from the sheets being on their toes all the time. You wouldn't think that they could, but it's a thing. So bed cradles are definitely useful. And one thing that's kind of new to me, we just recently started using them where I work, a couple months ago, I think. But the brand that I'm familiar with, I don't know if there's others, but it's called a hover mat. And it's basically a mat that you lay underneath the patient, and there's handles all along the side, and it's made of a really durable material, and you actually can hook it up to a compressor, I guess, and it blows up this little mattress just a couple inches thick, and it almost works like what are they called? Like an air hockey table. Like there's thousands of little holes on the hover mat underneath, and it blows the air out. So it makes it super easy to blow this up underneath your loved one, and then you can push them up in bed, you can move them around. There's videos of how to use these. You can use them to help turn a patient. So they're super awesome, and they decrease the weight of a patient by so much. So if you find yourself in that position where you don't have any help, this might be something to look into. I don't know if there's other brands that are cheaper, or if insurance covers it, that would be awesome. But when I looked them up, I think they were anywhere from like $80 to a couple $100. So if you're able to afford something like that, it might be worth looking into. So I think that's all of the tips that I have for bedbound patients. If you guys have any questions, let me know and I'll try to answer them. If you're looking for some other information about how to do other ADLs, I also have videos on YouTube about feeding, making sure you're feeding safely, oral care for an unconscious patient, and how to help somebody ambulate and transfer from like a bed to a chair, for instance. So if you're interested, check out those videos.